Okay, so we're back now from creating a provisional chair side. I want to finalize or finish the lecture discussing the custom impression coping, because we've spent considerable time creating the provisional and using it to help guide our tissue. We've used it to find where our margin is going to be. The big question becomes, well, how do I go ahead and, now that I've created this beautiful provisional that I want the laboratory to create the exact contours, how do I communicate that to the laboratory? And the way we do that is we do it with a custom fabricated impression coping. And now the same as before, the custom impression coping can be used anytime under any of the techniques, whether it's at the time of surgery or following a traditional healing time. In the same way, it can be done direct in the mouth, just like we did a direct provisional. You can create a direct custom impression coping, or you can do one indirect, so that like we did on the model previously, is that we can go ahead and take the impression coping and create it indirectly in the laboratory, so that we don't even need to do it chair side, and forward that to the laboratory instead. So let's talk about the custom impression coping and the direct technique. So we've made our provisional and it's in the mouth. We've created the subgingival contours we want. We have the margin, the free gingival margin where we want it to be on the abutment. And the key is, well, how do we communicate this to the laboratory? Well, we do that with a custom fabricated impression coping. And now this is going to be done as a direct method in the mouth, chair side. We've created the beautiful contours. We remove the provisional. And as you can see, the soft tissue contour has maintained itself to some degree. The longer we wait, this may collapse, but if you can put that impression coping in immediately and get to work, starting to flow in your composite all around impression coping, just like we did with the provisional abutment, to capture the subgingival contour of that tissue against the impression coping, this is what our goal is. So we put the flow composite around the impression coping, we light cure it, and this is what we have. We go ahead and unscrew it, we tease it out. And just like the original provisional, when we started creating our provisional abutment, it's a little amorphous. We need to spend a little time now flowing composite around it and creating the subgingival contours that mimic the subgingival contours of the provisional abutment that we've already created. Go ahead and flow around, and we're going to do the exact same thing just as if it was the provisional all over again. We're going to go ahead and shape and polish and complete the impression coping. I'm going to put it back to the mouth. And we're going to go ahead, and what we'll do is we'll actually prepare that composite collar that we created with the flow composite right in the mouth, and we're going to prep this as if this is the free gingival margin. This is the margin on the crown, the margin on the abutment, and where we want it to be. So that now that it's prepared, my shoulder preparation, I can go ahead and take an impression of this and put this in the impression and send this just like this to the laboratory, now capturing all the subgingival contours of this that the provisional has created. And when they pour the model, a soft tissue model, this is what they get. They get the exact situation as it presents in the mouth chair side. And from here, they can go ahead and make the final restoration, and all the things are been captured in the soft tissue. Okay. Now the custom impression coping, we'll finish up with custom impression coping and the indirect technique, just like we did in the laboratory. We've already created the subgingival contour with the provisional the first time we made it, whether it was in the direct fabrication or the indirect fabrication. So rather than take the impression coping and then have to redo our efforts of creating the soft gingival contours around the impression coping, there's an easier way to do it. And the way we do that is we take our provisional, we go ahead and preset a lab analog for the implant in a stone model. We take our provisional and we go ahead and place it on the model, and once on the model, we go ahead and flow some impression material around the gingival third and let it set. Now what this has done with the provisional is that it is captured three-dimensionally in that impression all the subgingival contours of the provisional that we've already created, that's been in the mouth, that's guided the tissue, and has allowed the tissue to heal and grow into the position that we need and want it. So with this is a nice way to transfer the information to the dental laboratory. We remove the provisional after it's set. From here we go ahead and take an impression coping, we place it on the model, and what we can do is we can flow composite around the neck of the impression coping just like the provisional, and it's going to capture the subgingival contours that the provisional had. We're going to remove the impression coping, and as you can see we have our neck or our subgingival contours have been created just like our provisional. We can then go ahead and with a little flow composite we can modify it and shape it so that it has a better shape and captures identical the subgingival contours as the provisional. This way we can go back to the mouth and do just like we did before. We can prepare the composite at the exact level at the margin that we want and create the margin where we want it to be. Take an impression of this and same thing. Send it to the laboratory and they can create the model to fabricate the final restoration. So the main theme here is don't be afraid to jump in. We've covered a lot of different material, a lot of ground here in regards to creating provisionals and provisional abutments and guiding soft tissue and creating emergence profile. The key here is to not be afraid to jump in. If you don't think that you're comfortable to sit chair side and do a direct fabrication of a provisional or a custom impression coping, then use the indirect, the direct indirect type techniques where you can schedule the patient, take the impression, make the model, do all the model work ahead of time, contour the soft tissue model, create the provisional, and then come back to the mouth doing any final modifications that need to be done chairside in order for you to get the final restoration, the final aesthetics that you're looking for. So the main thing is just don't be afraid to move forward and try these techniques. I want to thank Dental XP for allowing me to present this information to you. It's been a pleasure, and I am Dr. Gerard Lemongello, and I want to thank you very much.